Hello, my name is Elizabeth Whidden. I am a second-year medical student at the University of Pennsylvania Perelman School of Medicine, coming today from the Department of Neurosurgery to talk about global disparities in the management of traumatic brain injuries. Traumatic brain injury is a leading cause of death and disability worldwide, and its potential to cause loss of life, lifelong morbidity, and the social and financial implications of traumatic brain injuries make it a pressing public health and medical problem. Globally, approximately 90% of injury-related deaths occur in low and middle income countries, and autopsies show that traumatic brain injury is responsible for a substantial portion of these deaths. Some literature estimates that about 50% of these injury-related deaths are the result of brain injury. Additionally, there is a lot of inequity in access to care across the world, and in many parts of the world, care as well as methods of monitoring and diagnosing traumatic brain injuries are inadequate. Unlike most neurosurgical diseases, traumatic brain injuries are usually preventable, which means that there is a significant role for public health efforts to prevent development of these traumatic brain injuries, but also to improve equity in access to care. So looking here at the global prevalence and incidence of several most common neurological diseases, you can see here in this graph on the right, multiple sclerosis, Parkinson's, Alzheimer's, stroke, and traumatic brain injury are all very significant neurological diseases. Incidence is shown here in blue and prevalence is in green, and you can see the incidence of traumatic brain injury is significantly higher than that of other neurological diseases. And neurological disorders are the leading cause of disability-adjusted life years loss and second leading cause of death globally. And as you can see, as mentioned previously, the incidence of traumatic brain injuries is much higher than that of other neurological diseases, making it clearly a significant global health concern. Additionally, many sequelae of traumatic brain injuries, such as memory and cognitive loss, are unrecognized and underreported. In much of the world, traumatic brain injury is reported on a binary, either death or no death, and more mild or moderate cases are often underreported. So comparing the etiology of traumatic brain injuries across the world. So the most common mechanisms of injury are fall, injury from road traffic collision, and assault and violence. And there is a variation in the most common etiology of traumatic brain injury development. So as you can see in parts of Europe, the United States, and a few other countries, fall is the most common etiology. And then in most of Asia, some countries in Africa, South America, Canada, road traffic collisions are the most common. And then in some countries in Africa, assault is the most common. And gray countries, gray signifies countries that we don't have recorded data from. Global incidence of traumatic brain injury is actually on the rise, and this is due to a few reasons. Primarily, across the globe, we have an aging population, at least in many countries, and with aging comes increased risk of fall. And so that accounts for a significant portion of the increase in traumatic brain injuries. But additionally, in a lot of low and middle income countries, we are seeing an increase in population density as the countries grow, and with that comes increased urbanization. You can see in this graph here, blue represents the total population projected up to 2050. Red is the number of these people living in rural areas, and green is the number in urban. And as you can see, that is steadily on the rise. And with increased urbanization comes increased use of motor vehicles, motorcycles, and bicycles. And in many lesser resourced countries, we're seeing a great increase in the use of these motor vehicles, but not yet the safety standards in place to make their use safer. You can see here, this is looking at the global incidence of road traffic accidents across the world. and darker red represents areas with increased incidence of road traffic incidents. And as you can see, the global south experiences much higher incidence of road traffic collisions. Okay, so taking a step back and looking at disparities in traumatic brain injury outcomes, as we just talked about, people living in low and middle income countries are at greater risk of developing traumatic brain injuries, primarily due to increased risk of road traffic collisions. However, people living in these countries, despite being at greatest risk, are least likely to have access to needed medical care. They're actually twice as likely to die after a severe traumatic brain injury as compared to people living in high-income countries. Additionally, as discussed previously, rates of mild and moderate traumatic brain injury are likely underreported in low and middle income countries, and therefore often not managed in hospitals. In terms of disparities in access to neurosurgical care, each year, an estimated about 23 million individuals worldwide require neurosurgical care, and 14 million of these individuals will require neurosurgery. However, about 5 million people, primarily living in low and middle income countries, will require neurosurgical intervention, but not have access to it. This is looking at the proportion of patients by region with access to neurosurgical trauma care within 2 hours of home. So green represents closer to 60%, whereas red represents closer to 20%. As you can see, most of North America, most of Europe, Russia, have about 60% of their population lives within 2 hours of neurosurgical trauma care. But that in the global south, that number starts dropping. And in most of Africa, only about 20% of the population do. And this is partially reflected by disparities in the number of neurosurgeons per capita worldwide. So this graphic is showing the density of neurosurgeons, with green being higher density and red being lower density. You can see Japan here, darkest green, has the highest density across the world. But much of South Asia and Africa have very low density of neurosurgeons, and there are over a dozen countries in Africa that don't have a single neurosurgeon in the country. Just to kind of summarize this disparity in care, only 6% of neurosurgeons require care to 34% of the world. And again, this is looking at people living in low and middle income countries. And an estimated 23,000 additional surgeons are needed in lower and middle income countries to correct this disparity. So that seemed, to try to address this inequity, your first thought after seeing this data might be, we need to get more neurosurgeons. But clearly, as is easy to imagine, this is a very challenging thing to do, would require a massive amount of resource investment and a lot of time to establish training facilities and train individuals to provide neurosurgical care. But that doesn't mean there is nothing we can do to address these inequities in traumatic brain injuries. So when thinking about what makes a good public health solution, it needs to be feasible. Resources need to be available to implement it. It needs to be affordable. It also obviously needs to be impactful. It needs to make some difference in your public health problem. And it also should be contextually appropriate. It's not always helpful to just throw a bunch of equipment or resources at a country in hopes of improving their care if you also don't provide them with the training to use those, or if a country doesn't have electricity, giving them equipment that if many hospitals in a country don't have electricity, giving them equipment that requires that is just not useful. So those are important things to think about when implementing a public health solution. And so what can we do? I've kind of broken down public health improvements we can make into 4 categories. The first is to prioritize prevention to limit the number of traumatic brain injuries occurring in the first place. Improving early detection in clinical care is also can be a major target. Increasing rehabilitation options and increasing research and training in neurosurgery and to train more neurosurgeons. Starting with prevention, only 28 countries that are home to only 7% of the world's population have laws that address the top 5 risk injuries for injury and premature death. And you can see all of these are related to road traffic incidents. Include speeding, driving under the influence, lack of seatbelt use, lack of helmet use, lack of child restraint use. And so to put this in other words, this means that 93% of the world's population lives in countries that don't have laws addressing all of these risk factors. So most of the literature I encountered focused on helmet use and speed limits. Strong enforcement of helmet use was found to result in a 40% reduction in risk of death. And two-wheel vehicle users who don't wear helmets are 3 times more likely to suffer a traumatic brain injury. And helmet wearing rates in low and middle income countries is close to 0. So enforcing laws requiring helmet use clearly has the potential to significantly reduce risk of traumatic brain injuries following a road traffic collision. Helmet use is also relatively easy to enforce, particularly in like motorcycle wearers. It's very obvious if you see someone riding a motorcycle down the road, whether or not they're wearing a helmet, unlike enforcing seatbelt use or breathalyzer tests. You don't need to pull over someone first to check to see if they're abiding by this law. A challenge with helmet use is that the upfront cost of this is high. Motorcycle helmets that are effective can be in the hundreds of dollar range. However, and this is a cost that is often not accessible to many of the people living in low and middle income countries. Hundreds of dollars is a lot of money. However, it has been shown that using a helmet reduces the cost of hospitalization approximately $6,000 per patient. So from the perspective of a government in one of these countries, in the long run, investing in helmet use could have potential to significantly decrease healthcare costs associated with traumatic brain injuries. This is also could be a role for philanthropic organizations or public health organizations, such as the World Health Organization, the Bill and Melinda Gates Foundation, to invest money into purchasing helmets for motor vehicle users. Additionally, speed limit enforcement is also relatively easy to enforce. You can do so with even just a camera on a cell phone. And a study that took place in sub-Saharan Africa found that enforcement of speed limits was the single most effective intervention at reducing traumatic brain injuries from motor traffic accidents. Moving on to improved detection. Unsurprisingly, earlier care following injury is associated with better outcomes. However, as we saw before, a significant portion of the world, particularly in the global south, does not live close to neurosurgical trauma care. That doesn't mean that we still can't provide earlier detection, increased training of paramedics, other healthcare providers to provide initial management following head injury can make a big difference. Things like controlling intracranial pressure through head elevation or mannitol administration, taking spine precautions can make a big difference in outcome, especially if a patient is being transported several hours to a hospital, and are relatively easy to do out in lesser resourced areas. And so I propose that all healthcare providers should be trained in this initial management. In terms of improving clinical care, clinical guidelines to traumatic brain injury management have been found to be effective in developing countries. establishing protocols with clear guidelines to standardize the process and triage of patients. However, they have been shown to be less effective in lower resource settings due to lack of infrastructure, equipment, and trained personnel. And this is primarily because they are based upon use of CT scanners and ICP monitors, which are not available in many countries across the world. So I propose that we develop sustainable and realistic protocols for resource-limited settings to help guide management and resource allocation. So this is a quote by Monica Vavilala, who is the director of the Harborview Injury Prevention and Research Center at the University of Washington. She is quoted as saying, "It is also common for deaths to occur because the simple things are sometimes missed. Patients in smaller district hospitals may die because their blood pressure is not controlled or because they bleed out for the lack of suturing of a scalp laceration. Sometimes patients are not triaged upon revival, and so they are not attended to quickly enough. When triage does occur, the wrong conclusions are sometimes reached, and patients that could have been dealt with locally are sent off to more specialized centers, only to die on the way. These kinds of problems could easily be prevented by implementation or better use of triage processes." So what could this triage process look like? A 2008 study found that a model using Glasgow Coma Score, which looks at response to eye movement, motor response, and verbal response, age, pupil reactivity, extracranial injury, and time elapsed since injury can provide an accurate risk assessment. And so these are all things that can be done, examined outside of a hospital by any healthcare provider with minimal training. Again, to better triage patients and know who can be cared for at a closer non-trauma center by non-neurosurgical personnel, and who needs to be transported to a like potentially several hours to a neurosurgical trauma center. I also propose establishment of increased rehab services. So rehabilitation following hospital discharge after a traumatic brain injury has been shown to be highly effective at improving outcomes, and also has the advantage that it doesn't require extensive technology and equipment in the way that surgery does. However, rehabilitation services are not available or accessible in many low and middle income countries. And so again, I propose that we establish low-cost rehabilitation interventions in low and middle income countries because they require minimal resources and are effective in improving functional outcomes. This is a quote by Anupan Gupta, who is the head of neurological rehabilitation at the National Institute of Mental Health and Neurosciences. He was quoted as saying, "Rehabilitation following traumatic brain injury represents a continuum of management rather than an add-on or optional facility. A good way to begin improving rehabilitation care on the ground in a vast country like India would be to identify centers in all of the districts that could work as nodal rehabilitation centers and refer all traumatic brain injury patients to them." So clearly he was just focusing on the country of India, but I think a similar approach could be taken in many low and middle income countries to improve access to rehab. And finally, moving on to addressing the lack of neurosurgical personnel across the world. Again, here's that graphic. As discussed previously, one way to address this is to train all health professionals in initial detection and management, non-surgical management of traumatic brain injury, enabling them to all provide basic emergency support and be able to identify if a patient has traumatic brain injury or not. However, the long-term goal is to eventually increase the density of neurosurgeons across the world. And this will take a lot of time and investment of resources. But one way we can start is to establish bilateral partnership between institutions in high-income countries, such as the United States, and low and middle-income countries. And this will enable more research to be conducted on the actual situation of traumatic brain injuries in many of these countries. As discussed previously, it's suspected that there is a lot of underreporting of less severe traumatic brain injuries. And it is important to have nationals from that country involved in this research to ensure that it is culturally and contextually appropriate. And there's no literature published in neurosurgery from 113 low and middle income countries across the world. So establishing these partnerships is a great way to involve people from these countries in this research and increase understanding of the situation. Additionally, there should be increased involvement of neurosurgeons in decision-making spheres of public health policy, both globally and nationally. In general, other surgical specialties, particularly general surgery, has a much greater involvement in global health public policy than neurosurgeons do. And so increasing involvement in neurosurgeons in this will bring further attention to the matter, which will hopefully bring more funding to both research and establishment of training facilities to increase the number of neurosurgeons around the world. Okay, so to wrap things up, in conclusion, as we talked about today, global disparities do exist in traumatic brain injury incidence. People living in lower and middle income countries are at increased risk of developing traumatic brain injury, but there's also global disparities in their management and outcomes following traumatic brain injury. There are multiple approaches to reducing these disparities. First, I propose that we prioritize prevention through enforced helmet use and speed limits to reduce their incidence. I also propose that we increase rapid response to the scene by trained provider or paramedic, which has been shown to provide better outcomes by reducing the time that people have between getting their injury and receiving some sort of care. Establishing sustainable and realistic protocols using available equipment in these countries, but still having standardization of recognition of traumatic brain injuries and how to manage them has been shown to result in better outcomes. Additionally, in order to reduce the disparities in neurosurgeons across the world, I propose that we increase neurosurgical research in low and middle income countries through bilateral partnerships with high income countries, and this will increase opportunity and understanding of the situation. Additionally, we should encourage neurosurgeons to have increased involvement in global health dialogue to increase funding and research for training. And with that, thank you very much for watching.